What if the key to healing your body starts with healing your thoughts? Welcome to Reclaim Your Life with Irina, the podcast where we explore physical, emotional, mental, and spiritual tools that help you remember you are never really stuck. So much more possible than you think. I am your host, Irina Zhovtsov, and today I'm joined by Dr. Julius Torelli, a cardiologist with over 4 decades of experience who realized that treating the heart isn't just about arteries and medications. It is about mindset, emotions, and how we live a life. In this conversation, Julius shares the moment back in medical school when he realized that a patient's physical symptoms were actually rooted in emotional distress, and how that experience led him beyond the limits of traditional Western medicine. We'll talk about why your mindset can directly impact your physical health, how gratitude practiced intentionally can shift your body and your brain, what it really means to take responsibility for your own well-being, and how to balance the best of Western medicine with powerful Eastern principles. Julius now leads Gratefully Well, a digital platform dedicated to helping people transform their health from the inside out. And he's on a mission to build a community of people who are ready to stop outsourcing their health and start reclaiming it. If you ever felt like you are doing all the right things physically, but still not feeling well, this episode will give you a completely new lens on what healing can look like. Get ready to reclaim your life, discover inspiring stories, practical tools, and the path to true happiness. This is Reclaim Your Life with Irina. Let's begin the journey. This holiday season, skip the candles and gift cards. Give the woman in your life something that truly matters, or better yet, give it to yourself. The gift inside is for every woman who spent decades being everything to everyone else. It's time to remember who you are and rediscover your happiness. This isn't just a book, it's a permission to put yourself first again. Available now, because the best gift you can give is helping someone find themselves. Hello and welcome to Reclaim Your Life with Irina. Today we have a special guest, Julius Torelli. He's a cardiologist with 4 decades of experience, which has evolved into a comprehensive holistic wellness and preventative approach. His work focuses on mindset in health and illness. He incorporates often overlooked non-physical aspects of health, including mental, behavioral, emotional, social, cultural, and spiritual dimensions, and explores how mindset profoundly impacts our well-being. Welcome, Julius. It is a pleasure to have you.
Good morning, Irina. It's great to be here. I appreciate the opportunity.
Thank you. Thank you. So please share with us who you are outside of your introduction.
I appreciate the introduction and the kind words. So I'm a cardiologist, traditionally trained, and was in practice for the better part of 20 years before I did other things, but I've been practicing for over 30 years now, really. And my practice kind of evolved over a period of time. I saw the things that Western medicine did very well, and we do a lot of great things. Most of them relate to technology. We've done a great job with just the development of technology. I mean, it's just even in my professional lifetime. So I graduated in 1986. So that's almost going on 40 years, and the development of the technology. If you would have told me 40 years ago or 30 years ago that we could replace a heart valve through essentially a needle stick, I would have said that was crazy. And yet, that's where we are. And that stuff has been wonderful. We've made a lot of progress there. So I always say in Western medicine, in the acute situations, or if we can find something physical that we can deal with, right, that we can repair or cut out, like heal the bone or set a bone or stop a heart attack, things like that, we're very good. The where we're not so good is when we don't find anything physically, but people have symptoms, people have illnesses, and some people term these medically unexplained symptoms, things like migraine headaches or belly pain like irritable bowel. And we've got a bunch of fancy names for them: chronic fatigue syndrome, non-cardiac chest pain, fibromyalgia, and chronic pelvic pain. We did a bunch of different terms for what I think those terms are. Your not feeling well, you're sick, you're having symptoms, but we're not smart enough to figure out what's going on because we can't find anything physical. And so we relate everything to the physical nature because that's sort of the end manifestation of where things show up. What we don't really concentrate on, much or at all, is those what I like to call the non-physical dimensions of health. So things like mental health, which we give a little bit more credence today to than we did 30 years ago for sure. Behavioral and emotional and even cultural and social and spiritual health, I think are important. And so my practice has kind of evolved to incorporate, especially in these people who have these medically unexplained symptoms, but even people with chronic disease, like known chronic disease, like diabetes or heart disease or cancer, benefit from this holistic sort of approach. Because if you have cancer, as an example, right? The chemotherapy is important, the surgery may be very important, but there's also, again, there needs to be attention to and supporting the mental health and the social health, and there's a lot of changes that are going on, and so being able to incorporate some of these tools that affect mindset, affect mental health, I think can be very important.
Totally. Thank you so much. What are you passionate about?
I have a lot of passions, but my biggest passion, right now is, I'm 65 years old and I was trying to decide what direction do I go at this point in my career and my life. And I really wanted to share my experience because I had my own personal experience, which, was difficult. And I had to find a way sort of through that. And then this professional experience where things, again, it's what I'd like to call a non-traditional kind of approach to medicine. And being able to not so much, I don't think of it as teaching, I think of it more as sharing, maybe guiding to help people see, that they have some control of their healthcare and health more so than they believe. Because in our society, I think a big issue is that we put all of the control of your healthcare onto the provider, and that's a problem because when it's out of your control, you expect the physicians, to take care of everything. You expect them to figure out what's going on. You expect them to fix it, and people don't take any responsibility at all for their own healthcare, and I think that's a big issue.
You're absolutely right. Maybe it's from the fact when we're growing up and we deflect everything to figures of authority. Somebody always tells us what to eat, how to dress, when to say yes, when to say no. So we outsource our healthcare, we outsource everything to other people.
Well, yeah, I mean, it's a great point. I mean, and important. We in our society, a lot of people say, the healthcare system is broken. And I'm saying, well, it's not. I'm not sure that's so much broken. I think it's functioning the way it's set up to. The issue is the foundation of the healthcare system, which is an illness-based model, right? So when we talk about wellness or prevention, we actually, in Western medicine, know very little about wellness and prevention. Outside of vaccines, we know very little. And again, from the revenue standpoint or financial standpoint, it's, again, an illness-based model. The system only generates revenue when people get sick. If no one got sick in the way our system is set up, the traditional healthcare system, that is physicians, healthcare providers, hospitals, they don't make money unless people get sick. And so that becomes an issue, right? Because then you, again, as you sort of said, we're brought up as there is this entity out there, a physician, a healthcare provider, a hospital. That's where you go when you're sick. But no one in our society really, if you think about, hey, I want to stay well, I don't want to get sick, you don't think about going to your physician for that, right? I always say, no one wakes up in the morning feeling good and wants to stay well and say, well, I want to make sure that I don't get sick. I'm going to go to my doctor today and see what he's got to say. Because when you do that, even if you're doing your annual physical, everyone says, oh, that's a preventive thing. it's not really prevention. It is more looking for things, right? So they do screening, they do a mammogram to look for,
Let's see what's broken.
yeah, let's see what we can find early on. And that's not prevention, that's early detection. Now, I'm not knocking early detection. It's much better to detect cancer early or disease early because it's easier to treat it. But it's way easier to treat it if you never get sick in the first place. Yeah. And so, so that's a bit of a problem.
What was the moment in your life that caused you to wake up when you decided to shift to this way of thinking?
The shift evolved over decades. What the moment that I realized that there was an issue was my last week of medical school. I was doing a family practice rotation, and I don't believe in coincidence. Everything happens for a reason. So this was the last week, and that's important. A wonderful woman came in, middle-aged woman, and she was sick. She had nausea, vomit, and dry heaves for like 3 days, and she couldn't keep anything down. And so the attending physician, I was still a medical student, wanted to know what would I do. So I said, well, I don't know what's going on, but we probably should put her in the hospital. She's dehydrated. Give her some fluids, hydrate her up, and do some tests. Back in those days, we could do that. You could put people in the hospital to do tests. You can't really do that today, but insurance doesn't want to cover that. But that's another story. And so we put her in the hospital. We gave her some medicine. We did some tests. Over 3 days, all the tests, upper GI, x-rays, CT scans, all came back normal. And then she was feeling better after about 3 days. And so I went to discharge her, and I was sitting in her room writing her discharge orders, and I was making some small talk. And I said something corny like, well, now we can get you home so you can get some real rest because you can't rest in the hospital because they're always bothering you. I kind of chuckled, and she didn't. And she looked at me and said, well, I wish. I said, what do you mean you wish? She says, I wish I could go home and get some rest. And I said, well, why can't you? She said, well, in the last 6 weeks, my husband left me, my dog died, and my house burned down. And in that instant, it was like I just had this flood of thoughts. I mean, it became intuitively obvious to me why she was sick. The sickness or the symptoms, were from, let's call it overwhelming emotional distress, right? That those are all big things, and they happen sort of all at once. And then my next thought was, wait a minute, at that point, it was 2 days before graduation. And I said, this is obvious to me, yet I never learned anything about this in medical school. So that was my second thought. My third thought was, well, if I didn't learn anything about it, maybe it's not a real thing. But yet I knew if I went out and asked 10 lay people, or 10 grandmothers, they would all say, no wonder she was sick. That's obvious. And then I was like, well, I go to read about it in the library. And then I said, I have a whole library. I don't even know where to go to look this up or to read about it. How do you diagnose it? How do you treat it? Those are the two big things we do in medical school, diagnosis and treatment. And I said, I don't know how to do either of that. And so I was left very confused. And again, it was a busy time. I had to pack. We were moving to Cleveland, and it was, a busy time. But that patient stayed with me. And then I saw that same patient, those symptoms repeatedly in my training, where people would come. And when you're training, most of the stuff is in the hospital, more so than outpatient. But even in the hospital, a lot of people showed up with all sorts of, complaints, from headaches to chest pain to belly pain to back pain to fatigue to what have you. And we never found anything frequently. And so then my practice started to evolve to where I said, well, wait a minute, what are we doing for these people? And that became challenging because I saw when you come in with symptoms, you get evaluated, and that's appropriate. You have a headache, you have belly pain, you're having chest pain, you want to make sure there's not maybe a brain tumor, you want to make sure that you don't have Crohn's disease or ulcerative colitis or appendicitis, you want to make sure you're not having a heart attack if you're having chest pain. So you need that evaluation, because if it is going on, obviously that needs to be addressed. But a large percentage of the time, most people who come in with headaches do not have brain tumors. And so then you don't need a procedure if you can't find anything physical. And so then we start to treat that with pharmaceuticals, because that's the only other thing in our toolbox, our procedures. In Western medicine, we tend to have procedures and pharmaceuticals. And so pharmaceuticals can come a long way, and I'm not even knocking those, but But the pharmaceuticals never really, outside of antibiotics, most pharmaceuticals don't cure anything, right? They're more chronic sort of things. So you've got antibiotics that can be curative. Chemotherapy can be curative, although a lot of chemotherapy is not curative. So it becomes an issue because we never get to what I call the foundational issues, right? In other words, if you're having headaches and we treat you with medicine to prevent the headache or to treat the headache or to treat your depression or your anxiety or your insomnia or whatever, and you might be on all those, you might have all those when you're having headaches because you're stressed, but even though the healthcare system, medical establishment says, yes, stress is a cause of migraine headaches or a contributing factor at least, but yet we never treat the foundational issues, right? So like I think if you have migraine headaches, yeah, you might need the medicine, but I think everyone with migraine headaches should also see a counselor, a therapist, and also get, evaluate mental health, emotional, behavioral kind of stuff to see, because there's a lot of things that can be done today, especially besides medication. It's not just, okay, you go see the psychiatrist and you're going to get an antidepressant. Again, not knocking the antidepressants, although the evidence for antidepressants is not as great as everyone might seem. But regardless, I'm not knocking the antidepressant, but okay, fine, use the medicine. But what's causing this depression? What's causing the stress? How are you looking at your life, right? Because that's where the stress is. You're interpreting the events in the world as stress, and you can reframe the way you look at the world, and that it's not that stress is necessarily good, but it can be beneficial. And there's now research that shows it's not so much the actual event or the stress that's causing the symptoms, it's your interpretation of it. If you call it stress, right, you go out to give a talk and you get a little nervous. You get some butterflies or what have you, and you call that, I'm stressed, and you think of it negatively. But if you think of that as, I'm excited to go give this talk, and I'm getting these, these butterflies or palpitations or whatever, same symptoms, different interpretation, and it has massively different effects on your physiology.
Totally. I love that example. I think it's very relevant, and you're right, because it's the same symptoms, the same feelings, but it's how we see it, because we all see the world through the filters. We all have our own idea, our own expectation of how something's supposed to be, and our own story that we tell ourselves about a single event. Like right now we're having a conversation with you, and you have a totally different experience from what I am having. And not to say one is bad, the other one is not. It's just we bring our own perspective. So stories are so important, and that's what it can break you or it can make you stronger. The stories that we tell ourselves.
Well, it's an interesting that you say that, because for years I sort of heard some people saying that kind of thing. I used to go, "What stories? What do you mean stories? It's like my life. It's not a story. It's just my life." And yet now today, it's a story. It's a story you create, and you're right. There's plenty of evidence. If you show 10 people an event, they all interpret it differently based on their perception, based on their experience, past experience, based on where they are, how they're feeling that particular day or what have you. And people need to realize that. I think Kelly McGonigal, who's a psychologist over at Stanford, gave a TEDx talk. I want to say it was like 3 or 4 years ago, which means it was probably 6 or 7 years ago, and talked about that stress. And I encourage everyone to listen to that. She wrote a book about it as well. And it really, I think, is important, because the reason is because you can change your interpretation, you can change your perception. And that was the big thing for me when I realized or learned that perception is a choice. That blew my mind, because I always thought, this is just the way it is. It's just negative, and it's just positive. That's the way it is. But it's not like that at all, and it's very interesting to see and to watch when you become aware of that. One of the things I stopped, early on in my career, I stopped telling people what they should do. In other words, physicians say, cardiologists, we always say, you have all this blockage in your vessels, you have 3-vessel heart disease, you're sitting on a time bomb. We would always try to, and you sort of, it's not you're lying, you believe that as a physician, And the evidence, the evidence that exists, the studies that have been done would show that patient would do better with surgery compared to medications, let's say, or surgery compared to even, a percutaneous intervention, a stent or something like that. And that may be true scientifically, but when you talk to the patient who might be scared to death because I don't know why, maybe their father had a heart attack and died during surgery, or they had bad family experience, who knows what, but they're afraid. If they go, you convince them to have the surgery, when they go into the surgery with this negative sort of expectation, I don't want to have this, I'm so scared, I'm so, whatever. I just found that those patients were much more likely to those were the ones that had the complications, those are the ones that took longer to recover. Whereas when you saw patients who went in there, it's like, oh, I'm so glad I'm here. I've got the best physician. I've got the best hospital. I'm at the right place. They're going to go in. They're going to fix this, and I'm going to feel better, and I'm going to be able to go live my life, and this is great. And those patients tended always to do better. They always had less pain after surgery. They moved got up out of bed. They were walking more. They left the hospital earlier and things like that.
You're so right. Mindset is key. Because with those messages, we kind of send a signal to our body what to do. If we set negative expectations, our body doesn't know any different if it's going to hurt us or make us better. It executes the order exactly as it was programmed.
You've got it. But we don't teach that in medical school.
So, as a result of this wake-up call, what were your 3 biggest lessons?
Well, that's evolved too, and starting Gratefully Well. So I've left practice and I started this company called Gratefully Well to try to take what I did with patients one-on-one and try to transform that to this digital educational platform that I call Gratefully Well. And so I have a newsletter that's free on Substack and a website and all that. But as I was I've been doing this for maybe 6 months now, trying to figure out, how do I transform this from face-to-face in person to this online space. And so I've had to the model sort of existed in my head, but I needed to figure out how to write it, how to present it so that people sort of could understand that when they were reading it or when they were hearing a video or something like that. So probably the single biggest thing I've realized, well, first of all, I'll work backwards. So gratitude was a tool that I've used because it's very effective. There's a lot of evidence that shows that gratitude is beneficial, has both physical and mental health benefits, and it's an easy tool to use. And I have a specific, all kinds of any kind of gratitude is good. I specifically use this one technique I like to call the traceback method, and we can talk about that. So that's why the company is called Gratefully Well. So the gratitude is very important. But as I thought about that, so that was sort of one, but that's a tool. That's not the foundation of the program, but it's so that's like third of the 3. Second, working backwards was, I said, well, it's not really about the tool. It's about mindset. This is really Gratefully Well is all about this trying to guide people in this understanding of how important mindset is in our society right now. Mindset's kind of a fad. Everyone's talking about it. The phase we're going through, and we talk about it in peak performance. We talk about it for leaders. We talk about it for CEOs. We talk about it for athletes. But it's important in healthcare too. So obviously, being a physician, I relate it to healthcare. And so this whole mindset thing is critical. So that awareness was sort of number 2. But then I said, but it's before the mindset, you have to have what's number 1, which is the willingness to take responsibility for your own healthcare. So this is something in our society that I think is huge. And so again, we'll relate it to healthcare, but it's true in life in general. And that is, we put all of the power or control, as we were talking about, onto the physician or the healthcare provider to fix you, right? To figure out what's going on and to fix it. So if you're having headaches, you expect the physician to figure out what's going on and you expect him to fix it, right? But again, as we talked about, we know that there's an emotional component to that. People will call it stress. I like to rather call it an emotional component. And that emotional component relates to you. And so that is something that you can do something about. So yes, again, you might take the medicines, but in the meantime, you have to be willing to take some degree of responsibility for your health care and for your life. I think, again, it relates to life, but certainly you have to take responsibility for your own health care and start to do some of the things that, become aware of things that you need to do. So diabetes is probably my favorite example because yes, you may need to have the genetic predisposition to develop diabetes. Okay, well, that's a given. But just because you have the genetic predisposition doesn't mean your fate means you're going to have diabetes. You can modify the expression of those genes by your lifestyle. And this is very important for people who don't understand. So you go to the physician and he says you have diabetes, and he says, okay, you need to be put on this medicine. And again, the medicine's important. I'm not knocking the medicine, but diabetes, besides being a genetic sort of issue, is also a lifestyle issue. And so in addition to, there are things that you can do, like watching what you eat, or becoming more active and losing weight, and all of these things that are important for people to do. But in our society, it's like, just give me a pill, right? And I'll go on with my current lifestyle and not make any changes. Not that those changes are easy. So the number one thing, again, is that in health, people need to take responsibility for their own health care. But in all of life, this relates to really all of life. And when you start to look at life that way, that you're an active participant, life is not being done to you. You're playing an active part of that. That becomes very important. Now, the problem with that is that it's easier to play that victim, to choose that victim role. Oh, this is being done to me. He did this to me. She did this to me. That group did this to me. This government did this to me. This company did this to me. This boss did this to me. Right? When you look at it that way, I call that choosing the victim path. And that victim path feels easier because you don't take any responsibility, right? You don't take any of you say it's not my fault, right? And so you use that as an excuse, but that's a trap. It's an absolute trap. Once you are along that victim path, then there is nothing positive that happens out of that. That whole path is aligned with negative emotions and ends in misery. But once you get off that path to what I like to call the victor path, right, or the non-victim path, once you get on that and you start to look, hey, I do have a role here. There are things I can change. I can perceive things differently. Then magic starts to happen. I don't know how it works. They didn't teach me in medical school how that worked, but it does.
I love it. And you're so right. Those are so important. Yeah, first is willingness and to take responsibility for your life. Oftentimes we only want to take responsibility for the good things of our life, but any mishaps, any bad stuff that happened, it's like, that's not my fault. Somebody else did it.
It's not my fault. If you find yourself saying that, like, you need to really rethink, because once you say that, everything's out of your control. Right? When you start to look at it as being on this victor or non-victim path, then it's in your control. There are things you can do to change it. And for me, that was enlightening. That was a positive thing. For a lot of people, it's not. A lot of people are like, no. I just want to blame everyone else. And this is not a blame thing. It's responsibility, which I differentiate blame from responsibility.
Yeah. And the second thing you mentioned is the mindset, and I think mindset controls everything. From that, everything else stems. It's up to us to choose to have a positive or a negative mindset. We are the creator, we are the orchestrator of our life. We create this life, which is like a theater, where we get to perform the role, we get to judge the role, we get to criticize, and we are our own worst critic. Nobody would ever criticize us as much as we do ourselves.
For sure.
This inner show going, every comment on everything that we think or do or don't do, there is always critic there in the background. And finally, the fact that you created Gratefully Well, I think it's such a beautiful way to share with people that, it's not just physical health, it's also mental health, and gratitude is such an important component of that, because gratitude allows us the ability to shift from what's not working to what is working. And it kind of expands our ability to appreciate things that are great. And when we focus our attention on things that appreciate, suddenly more things will pop into mind, because our mind is our faithful servant, always wants to please us.
Totally.
So if we give a good direction, it will give us, in our worldview, to here it is. Here is another thing that's working, and another thing that's working, and your situation may be not so hopeless as you originally thought.
Totally. And again, just because I'm, as a physician, what amazed me when I started to look at the literature is the literature that exists for health and gratitude, and how gratitude changes physiology, right? And this is again difficult for some people to sort of understand, but it's not that difficult. Like if you're, I like to use the lemon example, right? If you sort of relax and picture a lemon, picture cutting the lemon and picture biting into that lemon, you salivate, you have a physiologic response, but there's no lemon. If you're laying down at night trying to go to sleep and you're falling asleep and you hear a noise downstairs and you think someone broke into your house, your heart starts racing. If you measured your blood pressure would be up, your sugar goes up, your pupils dilate, and no one broke in, let's say, right? It was just a thought of someone breaking in. And so people don't understand the power of a thought, that it can change physiology, and that the thought, goes back to then beliefs. Beliefs, nothing more than a recurrent thought. Beliefs are all about mindset. And so I used to talk about thoughts. People didn't like that so much. It changed to beliefs. But when I talked about beliefs, sometimes there's a religious connotation. There's all sorts of different connotations. So I switched to mindset. But it's all the same thing. It's all this, how much your thoughts, you use the word, your creator of your life. They're creative. I always say, thoughts are creative. Be careful which thoughts you choose.
Thank you. So now that you had your wake-up call and you had your lessons, what is your mission now?
So another thing I've thought a lot about, because I was trying to, I'm at this stage in my career where I was like, do I, just sort of retire and kind of go right off into the sunset, as we like to say, or do I share this, or do I do something, or do I continue working? And so I really felt pulled or compelled, or just felt a desire to try to share this, because I think, it's out. If you go outside the healthcare system, a lot of people are talking about this. Again, mindset right now is a very big sort of topic, right? And some people relate it a little bit to healthcare, but being a physician and being that I've, been in this business for 40 years, I think there's a message there that, and we didn't talk much about my own personal story, but there was a lot of that for me as well. And so it's where I am today as a combined personal and professional kind of experience, and being able to share that. And so how do I do that I'm still trying to figure that out. So again, I have the newsletter that's on Substack, which is free. So I encourage people to subscribe to that. But I will start doing workshops. I was going to do a 3 or 4 week workshop that was going to be free. I've changed that idea because people were a little bit intimidated by making a 3 or 4 week commitment, not knowing what they were getting into. So I'm going to start with just an introductory masterclass and do that first. And then and we'll probably have those ongoing as well. And then we'll have workshops too. I'm trying to really establish a community of what I like to call like-minded individuals who are willing to take responsibility for their healthcare, who are looking for resources and for support, looking for community that they can turn to be part of. So as I'm building that community, which will be mostly online, but I would love to be able to do live events as well, around the world, really, because I think this is a global issue. I think it's not just in the United States. The interesting thing is a lot of the principles are more Eastern kind of principles, but the people in the East want to be more like the people in the West. I think we should be more like the East. We need a balance, right? I mean, both are good, but we need a little bit more of a balance. So I would like to do that as well.
Thank you. I love what you have created. I think it's so important. And I love that you need a balance. It's not just one or the other, because there are good things in both places that we can kind of take and incorporate into how we live our life.
Totally. And I think that's important again, just to go back to the Western medicine. As I say, I don't want to throw out the baby with the bathwater because there's a lot of good things in Western medicine that we do. I mean, we can treat a lot of things better today or diagnose things easier than we could before. So it's not like saying, hey, everything in Western medicine is bad, because there's a lot of sort of bad talk out, people who especially who have left the healthcare system, who knock everything about it. And I know where that's coming from. There's a lot of money in the West, the healthcare system now, I think is over a $4 trillion, system. So it's big. There's a lot of money involved. And so I understand where that comes from, but if you can get rid of all that and put that aside, there's a lot of great things that do happen in Western medicine. So again, we don't want to throw that out. But having said that, there are things that we can do better, and there are things that we can address in a very different way. And I think one of the things Western medicine doesn't do with chronic issues, autoimmune disease is another great example, right? All of these, there's a lot of autoimmune diseases out there like multiple sclerosis and rheumatoid arthritis and things like that, lupus. Those those issues are basically what happens there is your immune system goes awry and starts attacking your body. And so that's an interesting sort of phenomenon because the immune system is really set up to differentiate what we call self from non-self. So if anything non-self invades the body, a bacteria or germ or whatever, the immune system, a cancer cell even, the immune system identifies that and kills it. It's not supposed to attack the normal cells, right? Again, very highly tuned to that. So when it starts to attack the myelin sheath of a nerve, which is what happens in multiple sclerosis, or the synovial membrane in rheumatoid arthritis, or your DNA in lupus, like why is it doing that? And so what we do in Western medicine is we understand the complex immune response, and it's very complex. And we understand that to a large degree, and then we target medicines to affect that inflammation, because that's what what ultimately is happening is that it's an inflammatory response. And we're good at that, but no one ever stops to say, why is this happening? We just sort of start in the middle. This is going on and we're going to target this. But why is this happening? And when you start to really talk to these people, you start to find they have similar personalities. They have similar sort of issues. And I think those things aren't addressed, and they need to be. There's a lot of, why would you attack yourself? And because that's what's happening ultimately. What are the issues with self-worth, self-esteem issues, self-hatred, not good enough, imposter syndrome, all these kind of things? How big are those for you? I think we all have those, every single one of us. Some people have, a small amount, some people have a large amount, but we all have that. And those things need to be addressed in someone with, let's just say, autoimmune disease as an example. And that's like a real disease, right? That's not like where, you can find something physical going on there. And so it's not like one of these medically unexplained symptoms.
Totally. Yes. Thank you. You make very important points. That we come in the middle, like we we don't get to the bottom, to the root cause of why something is. We just look at byproducts of why something is, and then we treat the byproducts. Meanwhile, if something was rotten, and you only came in and removed the first layer of the rot and put it aside, the rot didn't stop. It's still gonna continue and.
Correct. Exactly.
Get more aggravated.
But then also you say, well, why did this rot?
Yes.
Right?
Yeah.
Because they say, well, normally this, doesn't, we had whatever it is, this doesn't rot, at least at this amount of time. Eventually everything rots. But you say, why did this rot? Why did it rot early? And so that why we frequently don't ask. Because you see, what's happened is we think of ourselves as scientists. We think that medicine is a scientific thing. And I'm all for that. I was trained in the scientific method, and I certainly believe in that. And William Osler, who was sort of the father of at least modern Western medicine, said we have to go by the scientific principles. And I think if he would have known what would have happened because of that, I'm not sure he would have said that, at least not in that way, because he was a very wise man. And the issue with that is there's nothing wrong with science, but not everything lends itself to science, right? So what's happened in Western medicine is the things, because in science you have to measure something, right? You have to measure, so you measure, let's say, blood pressure. Blood pressure is easy to measure. You say, oh, look, blood pressure is high. When blood pressure is high, you follow these people and they don't do as well as people who have normal blood pressure. And so you say, okay, well, so now you measured something and you know that's detrimental. So now you develop a pharmaceutical that lowers blood pressure and you show that that lowers it. And then you do another study that shows when you lower the blood pressure with that medicine, it does, people do better. And so that's easy to do scientifically. But what about depression or anxiety or, other emotional sort of issues? How do you measure depression? Yes, there are surveys and scales to try to measure depression, but it's not easy like putting a cuff on someone's arm and getting a number like cholesterol or blood sugar or something like that. And so these studies become much more difficult to do. And because of that, I think we don't do those studies. Those studies, again, there are studies done, don't get me wrong, but they're very challenging to do and they're very difficult. And I would call them less scientific because, again, there's just a lot of other variables that things can sort of come in.
Yes, totally. Thank you. Thank you so much. Is there anything I haven't asked that you like to share?
I know we had a great discussion, so I appreciate it. There's nothing else I can sort of think of. Anything else you have? Great.
If people would like to connect and learn more about you, where would they go?
So the best place to probably go right now is the substack.com. So look for Gratefully Well, or you can look at my name. I think either one should bring up the newsletter, and you can email me there. You can also email me at admin@gratefully-well.com. Or you can go to my website. So I have a website, gratefully-well.com. There's a 7-day gratitude challenge there. If you want to do that, you can email me at the website. Those are probably the easiest ways.
Great. Thank you. It's been a pleasure to have you. We'll include everything in episode notes. Thank you for being on this mission to spread awareness and to educate people that it's not just physical health, it's also all the other components. And it's important not to outsource your health, but to
take some
learn what you can and then evolve better and always kind of have that reference point in the back of your mind.
Take some responsibility for your health and for your life. Yes.
Yes.
That doesn't mean that you don't go out and get some help when you need help. Because you don't put all of it. I don't say you have to take all your responsibility, but you just have to take some degree of responsibility. And again, that's not blame.
Yes.
I appreciate it. Always a pleasure.
Thank you.